Hello, Assalamu alaikum. It's me, Dr. Naseem Shirzad, the author of Naseem Shirzad book series. A lot of students asking about question on Ureter and FCPS Part 1 exam of all specialty. So today I am going to discuss with you all in a very the detail of ureter, like its full and detailed anatomy, the various construction in the ureter, the histology of the ureter, the various relation of the ureter, embryology of the ureter, and the surgical anatomy of the ureter. And I will be highlighting all those questions which are a part of FCPS Part 1 exam in a various years. And the second important things, it will give you a very good concept so to solve all the question in a very easy way. Number first, the size of the ureter, or we can say the definition of the ureter. Actually, ureter is a tubular structure that connecting the kidney with a urinary bladder, and it is around 10 inch or 25 centimeters. Sometimes they are asking the question in inch or sometime in centimeters. So better to have both in your mind. If they ask in inch, so it is 10 inch. If they ask in centimeter, so it's at 25 centimeter. It's also important to remember with it that is that the esophagus, the duodenum, and the duodenum, they all have same length of 10 inch and 25 centimeter, because they are asking same question in exam. The ureter is a retroperitoneal structure. It means it's outside the peritoneum. That's why much of the time when we are having approach to the ureter, we are going retroperitoneal. I means we are not opening the peritoneal cavity. This tubular structure is extending from the pelvic ureteric junction, and it enters the urinary bladder at the base of the urinary bladder. There is a question in FCPS Part 1 that how the ureter and where the ureter is opening. So it's opening in the upper lateral aspect of the base of the bladder. This diagram in front of you is explaining that it's opening at the base of the bladder in the upper lateral aspect of the bladder. So ureter is actually opening in the bladder at the at the upper lateral aspect of the base of the bladder, and then it having a mucosal tunnel which is 5:1. There was a question in FCPS Part 1 and they were confusing actually, and they were asking that is it can be palpated through the vagina. So it can be palpated through the lateral fornix of the vagina. And there was another question, can we palpate the ureter through DRE, digital rectal examination? So ureter cannot be palpated for rectal examination, but it can be palpated through the lateral fornix of the vagina. The ureter is not constructed at the psoas muscle. In the whole length and the whole passage of the ureter is not constructed at a psoas muscle. It's a landmark, but it's not constructed. The various construction site, the psoas has no role in the construction of the ureter. So keep in mind that the ureter is having the psoas muscle is having no impact on the construction. This is a question from FCPS Part 1 surgery. Now coming to the various construction sites of the ureter. The ureter is actually divided into 2 or 3 types, but regarding the construction it is divided into 2 parts. The first construction is at the level of pelvico-ureteric junction, means the place where the ureter beginning from the kidney, and it is located at a level of L2, and it is the same location for the origin of the renal artery from the aorta. So this is also from past paper basic news. Number second, this is the commonest site for congenital obstruction. I means this is the commonest site for POJO. So POJO, pelvic ureteric junction obstruction, which is the commonest congenital anomalies present at this level, right? And this portion the is supplied, this part of the ureter is supplied by the renal artery. The second construction, when the ureter is passing just at the level of the pelvic brim, or we can say the pelvic inlet. So they can ask pelvic brim or pelvic inlet. And this is the area where the ureter injured most commonly, right? And this part of ureter is supplied by testicular artery and ovarian artery. The third is the ureterovesical junction, the area where the ureter is just entering into the bladder. Remember, among all these three, this is the narrowest part. It's also from past paper, and it turns medially to open into the urinary bladder at the level of ischial spine. This is also from past paper. So it's opening at the upper lateral border of the base of the bladder at the level of ischial spine anteromedially. This is the narrowest part, and this is the most common site for renal stone. Renal stone most commonly stacking and occurring at the lower ureter, distal ureter, right? So this is the site for ureter stone. And the lower part of the ureter is supplied by the superior vesical artery. One thing is more important, now the blood supply of the ureter is actually their location is important. Like the upper ureter blood supply is located medially. So whenever we are going in to give incision, like in endopylotomy, we will be giving incision on the lateral side as the medial side containing the blood supply. While in the mid part of the ureter, the blood supply is located posterior, while in lower part the blood supply is located laterally, right? So better to remember with mnemonic like MPL, upper medial, mid posterior, lower lateral. So it's the blood supply location regarding ureter. It's surgically important not to give incision in the upper part of the ureter medially, because medial ureter located, so your incision should be on the lateral side. So this is also important. Now coming to the histology, there was a question in 2020, and they were asking that how is the lumen of the ureter is looking like. So it's star-shaped lumen, star-shaped small lumen. There's a basic one. Secondly, the epithelium, the whole length of the ureter is that of transitional epithelium. There is no muscularis mucosa in the ureter. And regarding the muscle, there are two layers. One is the inner longitudinal and the other is the outer circular smooth muscle. It's also important. Now coming to some surgical landmark in relation. But before going to start to discuss the various surgical anatomy and landmarks, better to have some understanding of the relation of ureter. Like the interior relation, it's better to remember with mnemonic like water under the bridge. Water under the bridge means the bridge is formed by the testicular ovarian artery, uterine artery, and it also important to remember that duodenum is also on the right side, it's not on the left side. So the interior relation can be remembered by the water under the bridge. Water under the bridge means that the water is running under the bridge, means the ureter is running down, and the bridge is above, formed by the testicular ovarian vessels, uterine artery. And the posterior relation is important surgically. The common iliac artery bifurcation is located posteriorly, the genitofemoral nerve is located posteriorly, and it is important when we are going to explore the ureter at the pelvic brim, we much of the time going to identify first common iliac artery, and that will give a clue and a bit important surgical landmark to identify the ureter at this level. Number second, when the gynae people when they are doing hysterectomy, and when they are going to try to tie the ovarian artery, they much of the time confuse that with the ureter, and they are ligating the ureter. And this area is also much of the time injured during gynecological procedure, and this is exactly the area where the second construction occurring, I mean the pelvic brim. So at the pelvic brim, the urean vessel or the urean artery, which is from past paper basic use, are commonly injured during hysterectomy when they are trying to ligate the urean artery. They are mistakenly ligating the ureter, right? But if they ask what is the commonest cause of ureter injury, that is iatrogenic, right? The other surgical things, the most common site of injury in the ureter overall is the level of pelvic brim while clamping the infundibulopelvic ligament where the urean artery is located. The most common type of injury, that is when the surgeon is trying to achieve some hemostasis, they are trying to do hemostasis, and then that's leading to the ureter injury. So that's also important, and is from past paper. Now coming to the embryology, because that's also clinically and for the various anomalies, the good embryology understanding is important. So the ureter is actually arising when the ureteric bud stimulate the mesonephric duct. When the ureteric bud caudally, when they stimulate the mesonephric duct, that's leading to induce the development of the definitive kidney. But for the development of the ureter, the ureteric bud will stimulate the mesonephric duct, and that's lead to the ureter development. But sometimes embryologically what happen, sometimes a patient is having duplex system. Duplex means having a two kidney. Now it can be partial duplex or it can be complete duplex. Complete duplex and partial duplex in simple words, the understanding is the patient will be having two moieties, mean one kidney will be having two moiety, one upper moiety and the lower moiety. When the both moiety is having two ureter and that are separately opening into the urinary bladder, that is called complex duplet. But if it is a single ureter and that bifurcate prematurely, means one ureter is from upper moiety and the other is from the lower moiety, and that bifurcate prematurely, so a single ureter will be opening in the urinary bladder, but in upper part, one part will be going to the upper moiety and the lower part ureter will be going to the lower part, and that will combine as a single ureter, and that will be opening separately into the bladder. But in case of complete duplex system, it will be a single ureter from upper moiety will be going downward to the bladder and opening to the urinary bladder, and from lower moiety it will be coming down separately opening into the urinary bladder. And the reason is the presence of the incomplete ureter duplication, means the presence of two ureteric buds, while in case of partial there is a premature bifurcation of the single ureteric bud. So this was all about ureter. If you still having any question, you can ask me in my comments, you can message me, I will answer them. I wish you all best of luck.